There are identifiable predictors of injury. I can't tell you how many people ignore these identifiable predictors. There's no good reason why runners need to get injured. But so many runners get injured because they don't take care to identify the risk factors and do something about it. So I put up a list here. Low energy or caloric availability, female athlete triad, we'll get into that. Previous injury, if you've had a previous injury, you're at a greater risk for another injury because you've shown that that body part is vulnerable. So if you've already had plantar fasciitis, you're at risk for having it again. Large increases in training load, that's the biggest one probably. The major reason why runners get injured is because they increase the volume or the intensity at too rapid of a rate for that body part to adapt. Strength imbalances, lack of running experience, and the last one, which is actually a minor one, inappropriate running shoes. You do have to have the right shoes for your foot type and your running mechanics, but that's an easy thing to fix. That's a 5-minute problem solver. You just go to the shoe store and get the right shoes. But a lot of people in society don't know what shoes they even need. The three that are the most important that I've highlighted: for women, the female athlete triad, which is a combination of 3 characteristics. One is menstrual cycle dysfunction, when they start losing their menstrual cycles and they're not regular every month. 2 is disordered eating, not to be confused with an eating disorder. An eating disorder is something else, but just disordered eating, which most of America has disordered eating. And 3 is osteoporosis, which means low bone mineral density. If a woman has any one or more of those 3 characteristics, they're at a much greater chance of getting a stress fracture because estrogen protects bones. So any condition that lowers estrogen puts a woman at risk for stress fractures. So this becomes a problem with female distance runners because they have low percentages of body fat. Because of either societal pressures or self-imposed pressures to look good, they don't eat as much as they need to eat to offset how many calories they're expending every week with running. And so they run into problems where estrogen is low. And when estrogen is low, then they're a much greater chance of getting a stress fracture. And that's why stress fractures, especially at the collegiate level, are rampant among female runners. Because there's no screening done to look at these athletes' bone mineral density. And it's very, very important at the college level when these girls are running a lot of miles per week, they need to be screened because the coach needs to know who's at risk. And that's why even for a male coach, it could be a little bit awkward conversation, but somebody needs to know if that woman, that girl on your team is losing her menstrual cycle. Because once a girl starts losing her menstrual cycle and becomes irregular, you're setting her up to get a stress fracture.